Hi, my name is Dr. Daniel Fox, and I'm a licensed psychologist in the state of Texas, and an expert in the area of personality disorders. And today I wanted to talk to you about borderline personality disorder and unstable self-image. Now, what we're going to do first is we're going to identify what that means, and we'll talk about another term, similar term. It's called identity diffusion. And then I'm going to talk about ways that you can build your sense of self-image, self-understanding that can help lessen a lot of the dissonance and frustration and other issues that come along with that unstable self-image that a lot of folks that are along the borderline spectrum and those who have borderline personality disorder tend to experience. Okay, so let's get started. So the first thing I want to do is I want to define what unstable self-image is, and we'll use the definition from the Diagnostic and Statistical Manual, 5th edition, and that's what mental health providers in the US and some other countries around the world, that they use this to identify and define different characteristics of different disorders. And so when we talk about that BPD unstable self-image, what we're talking about it's like identity disturbance that tends to be very noticeable, significant, and persistent, unstable self-image, or a sense of self. It's the feeling that you have no idea who you are or what you believe in. And what happens is when we break it down and we start to explore it a little bit, what does that really mean? What are the components associated with that? Well, a lot of times folks who have this issue, that there are sudden and dramatic shifts in self-image, which is characterized by shifting goals, values, vocational aspirations. So you could want to be a veterinarian one day, you could want to be a doctor the next, you could want to be a computer programmer, you could want to be a graphic designer, and you don't really settle on anything. So, but it relates to the sense of self. It's not a sense of attention deficit hyperactivity disorder, or inattention, where you can't focus on anything, or you're hyperactive and you're all over the place, or a manic phase that you're choosing things. Because with personality disorders, we would see that this issue of unstable self-image and those components that we're going to define a little more in just a second, but we see that it's across different factors. Okay, so it's something that is consistent. It doesn't necessarily wax and wane. It's this, different goals, different values, different vocational interests and aspirations and things that you want to do with yourself. And it changes just so rapidly that you lose this sense of identity and sense of self of who you are. Now, there also may be these sudden changes in opinions and plans about your career, your sexual identity, values, and the types of friends that you have. I've had some clients in the past that were unsure of the sort of collective friends that these individuals wanted, that these particular clients wanted, and they would fall into a group of what are called like goth individuals, and then they would then go into what are called like preppy individuals. Okay? And so they would sort of vacillate back and forth, and they never really knew where they fit. They didn't subscribe to the goth culture or the preppy culture, so they were moving in between and hoping that the culture would help define them, so that they would then have this sense of settling and peace and say, okay, this is where I'm meant to be. But that tends not to happen because of this unstable self-image and the expectation, that external locus of control, that you hope that the world is going to put that understanding on you, and then one day you'll just get it and, oh, see, this is who I am. Because that requires a little more exploration, and that's why I've attached the worksheet to help you sort of discover some of those things. But there are more issues related to that unstable self-image as well. So these folks who have this issue, that they usually have their self-image tends to be based on a sense of splitting, right? That they're bad or evil. They may at times feel as though they don't exist at all. So a sense of dissociation. Okay? I've done a video on splitting and disassociation. So if you think you have these issues, you can check that out. Now, these experiences usually occur in situations in which the individual feels that lack of meaning in relationship, nurturing, and support. And these feelings are really common for those that are along the borderline spectrum. And it's important that as you start to learn and develop your understanding and increasing your sense of awareness and sense of insight into that borderline personality disorder traits, that you are looking and defining what your relationships are, what is nurturing to you, what is your sense of support and what that means, and really looking into that and defining that. Now, that other term, sometimes the sense of unstable self-image, is also called identity diffusion. Now, this refers to the difficulties determining who you are in relation to other people. And this basically can be easily understood. It's that sometimes folks along the borderline spectrum is that they describe themselves as having difficulties understanding where they end and where other people begin. So where are those boundaries? Where's that definition? And that's where that identity diffusion is, that they sort of get enmeshed, get overly connected to someone else. So they don't understand where their values are, where those identified others, those important other individuals, where they start as well. So that identity starts to merge, which can create a lot of greater confusion. This can happen a lot also with your favorite person, a lot of that confusion, a lot of those other issues and stresses and difficulties that individuals with borderline personality disorder tend to have. And building that sense of understanding is so important in getting a sense of control about who you are, about how you see the world, and how you want to influence the world around you. Now, we know that self-image can be made worse for those that are along the borderline spectrum, seeing themselves as helpful and sensitive. This goes back to that splitting, right? But see, it's conflicted. So you know that you're a good person, or you're conflicted by the sense of being a good person, right? Because maybe you're kind to pets, you're kind to specific others, whatever it may be. But inside you have the sense of sadness, anger, and anxiety. And it's that paradox, that confusion, that feeds that borderline personality disorder. And a lot of those beliefs and views and values that you've incorporated, that you've built in as protective mechanisms over the years, that this has influenced your sense of unstable self-image. Okay? So within this confusion and all of these issues with this unstable sense of self, what can you do about it? How can you manage this? Well, so I created a worksheet, and the link will be in the comments section. And I'll go through it now. I'll tell you a little bit about what it's about and what's in it, and you can download it. And I encourage you to try it. It may be uncomfortable at first, and that's a normal response. It's normal to not know who you are when you're along the borderline spectrum, and you start to engage in some of that exploration, and there's a lot of confusion, there's a lot of dissonance. That part of borderline personality disorder starts to push and say, well, this is too hard, don't do it. It's easier to engage in those maladaptive beliefs, behaviors, and patterns, and it's easier to be destructive, and it's easier to go into drugging, drinking, promiscuity, other types of issues. But the reality is that to move yourself forward and grow beyond that borderline personality disorder, this exploration is a big part of that. So be patient with yourself. That's so important. Be patient with yourself as you start this exploration, okay? And the good thing about this is, if you're doing it and you're starting and you get upset, you can crumble it up and throw it out. And then you can print out another one. Okay, so do what you need to do. Be patient with yourself, please. That's so important. So on the first page of this worksheet, what it's going to ask you to define what your short-term goals are. Short-term goals are like 3-4 months. Where would you like to see yourself? What would you like to have achieved in about 3-4 months? Okay, and then it's going to ask you what your long-term goals are. And long-term goals, we can say it's 8 months or more. Okay, not too much pressure, just where you see yourself. Okay? And then also it's going to ask, what are your values from your most important to least important? Okay? And then just list it. And there's 5 lines, and if you don't have 5, that's okay. You just put what you can, all right? Then, what are your self-blockades? Now, your self-blockades, these are how you hold yourself back. Okay? That can be drinking, promiscuity, drugging, getting involved with people that maybe don't have your welfare at heart. They're more concerned with themselves than they are with you. So those can be some of your blockades, but recognizing you make the choice to be with those people. So you empower yourself with a sense of choice as well, and that's really, really important. Now the next part is what are your other blockades? This is what others do that holds you back. What are some things, behaviors, patterns that people that are in your interpersonal circle, and I did a video on the borderline narcissistic system and interpersonal circle as well, so you can check that out if you want to learn more about that. And so what are those? What are the other blockades? What are the others in your life? What that they engage in that may be holding you back? Then the next page asks you for today's self and future self. I love drawing, right, with my clients. I can't draw, but a lot of my clients are just amazing artists, and it's really amazing. So we like to use that in session. And what in this case, what I want you to do is you're going to see that there's a little area, right, that I've made in the worksheet, and it says, what is your today self? And I want you to draw with as much detail as you can. What's the surroundings? Who else is in the picture? What do you look like? Do you have scars? Do you have tattoos? Do you have, what's your hair, earrings, jewelry, anything? The more detailed, the better. Then, on the other side, right next to it, what is your future self? How do you see yourself? Now, how far down the road you want to go is up to you. Do you want to do it 9 months from now, a year from now, 2 years from now? You could even do 6 months from now. How do you see yourself? And the more detail that you can put into it, the more defined and structured the picture of who you are will be, which is so important when you're managing that unstable self-image for folks along that borderline spectrum. Okay? Then it's going to ask you to compare the two. Okay? And you're going to list, okay, what you need to do to be the person you want to be in the future. What are things you want to do to get to where you want to be? These are behavioral things. Try to be as specific as you can. Okay? Cut down on drinking, cutting down on drugging. Maybe if you have a significant other that is not a positive influence, changing that individual, whatever it may be. Okay? So, and as you make this list, you have to commit yourself to it. Okay? Now, I don't want to put any pressure on you. Okay? But when I say commit to it, really think about, is this something that I can do that's going to help me move forward? And even if you want to put some lofty goals in there, you can. These are things that I'd like to do because that's a start. Writing it out. Okay? Writing it out, pen to paper, is really, really important, and it's a real powerful experience. And we want to build that into your views of yourself, others, and the situations that you're in. So what do you need to do to be committed to who you want to be? And that goes into defining who you are. You really can do it. And I know that it might be difficult for you, and I understand that. This is a difficult process for a lot of my clients. But know that a lot of folks along that borderline spectrum are experiencing it as well. And people that are able to get that sense of self, they have a greater sense of control. And I know sometimes that can come with some fear as well. And understanding that fear is part of it, but it's also your borderline personality disorder talking a little bit, trying to put you back into those maladaptive beliefs, behaviors, and patterns that you can grow out of, and that it's okay to do that. So I really hope that you've enjoyed this. I hope you've learned a lot. Please download the worksheet and try it out. And please leave any comments about if the worksheet was helpful, if it wasn't. Any kind of feedback is always great. What do you do to understand your sense of self is important as well. Put that in there for other folks that may be reading it as well. Subscribe to my channel if you like this video and some of the other ones that I made. And I feel very fortunate that a lot of folks that have watched my videos say that they're getting a lot of benefit and that it's helping them, encouraging them to enter treatment, encouraging them to explore their beliefs, behaviors, values, and patterns. And I think that's wonderful. And I want to thank you for your time. And please know that you can manage a lot of the borderline personality disorder stuff. You can do it. Thank you. Have a great day. Bye-bye.